Has the COVID pandemic caused you to fall behind on your rent? What about your electric or water bills? Well, VIHFA's Emergency Rental Assistance Program is here to help you catch up. For program details and qualifications, go to VIHFA and click on the ERAP link. From there, it's just 3 steps. 1. Make sure you are eligible. Have you lost income due to COVID-19, owe at least 1 month of rent or utilities, and meet the federal household income guidelines for your island? 2. Gather all the required ID and documentation for all members of your household, plus statements from your landlord or utility company. 3. Submit your application online at vihfa.gov or call one of the intake centers on your island to make an appointment to apply in person. For more details and locations of the intake centers, please visit vihfa.gov.
Good day, and welcome to the Government House Weekly Press Briefing and COVID-19 update for the week of February 14th, 2022. For the benefit of the radio listening audience, I am Government House Communications Director Richard Mota. Happy Valentine's Day to you all, and a very special happy Valentine's Day to my wife, Iman, who I'm sure is tuning in. Joining me this afternoon is Territorial Epidemiologist Dr. Esther Ellis on behalf of Health Commissioner Justa Encarnacion for the latest COVID-19 data and information on where Virgin Islands residents can get a free COVID-19 test vaccine and booster shot this week. Dr. Ellis?
Good day, and thank you, Director Mota and Commissioner Encarnacion, for the opportunity to provide COVID-19 updates today. Before I begin with our numbers, on behalf of Commissioner Encarnacion and the rest of the VIDOH testing team, I share a sincere thank you to those who have taken the step to protect themselves and the community by getting vaccinated and boosted. Also, thank you to those who continue to hold steadfast to Governor Bryan's and the department's guidance to ensure a reduction of COVID-19 transmission. We are a remarkable people, and we are grateful for all the cooperation that we received from the other agencies, private supporters, and you, the community, for seeing us through the Omicron surge. It is not over yet, but we are doing better, so thank you. As of February 12th, 2022, a total of 322,351 tests have been conducted in the territory. Of those tests, 15,182 individuals have tested positive. The 7-day positivity rate is 5.33%. We anticipate the positivity rate to continue to trend downward as Omicron cases continue to decrease worldwide. There are currently 250 active cases in the territory, 141 active cases on St. Croix, 99 on St. Thomas, and 10 on St. John. 14,825 cases have recovered, and we have suffered 106 fatalities. The most recent 106th fatality was a 78-year-old woman on St. Thomas. We offer prayers and support to those who have lost their loved ones. As of February 14th, 2022, the Governor Juana F. Louis Hospital and Medical Center reported 2 COVID-19 admissions, with 1 vented. The Schneider Regional Medical Center reported 5 COVID-19 admissions, with 2 vented. We can all have a real impact on keeping our COVID-19 numbers and hospital admissions down by getting vaccinated, by being consistent with when and how we wear the mask, by practicing social distancing, and by washing our hands frequently. Please also remember how critical it is that we stay at home when we feel sick and call the hotline to get tested if you suspect you are infected. Early detection can help slow the spread of the virus to loved ones and others. Some updates. As a reminder, all Department of Health testing schedules on St. Croix and St. Thomas went back to the original pre-Omicron schedule last week. The hours for testing for persons who are ill or suspected close contacts is now 9 a.m. to 12:30 p.m. by appointment. Please pre-register for testing using this link, www.covid19usvi.care/testing. As of today, testing on St. John has returned to its previous schedule, where testing is only available Wednesdays from noon to 3 p.m. Excuse me. At the gravel lot. Back to you, Director Mota, for 1 second.
Thank you, Dr. Ellis. As we mentioned last week, our students are back to in-person learning. As you know, we have introduced a new vaccine incentive for children ages 5 through 17 as part of our effort to protect the health of our students and school-based personnel. Minors ages 5 through 17 will receive a $250 Visa gift card once fully vaccinated in the territory. The VI Youth $250 gift card giveaway begins today, February 14th, and runs through Friday, March 18th. Any child residing in the U.S. Virgin Islands between the ages of 5 and 17 who receives the second dose of either the Pfizer or Moderna vaccine between today and March 18th will receive a $250 gift card at the time they receive their second dose of the vaccine series. Of course, we continue to encourage the parents of our students to get their children vaccinated and continue to encourage our school-based personnel who are not yet vaccinated to please go out and do so. We also want to thank those parents who trusted the science and did not hesitate to get their children vaccinated as soon as the COVID-19 vaccines became available for their young ones. Those children who have already been fully vaccinated before today will also receive a $250 Visa gift card. The Department of Health is compiling the names of those individuals and preparing to distribute the cards beginning on February 16th. As a reminder, the gift card is per child, not per household. So if you have more than one child in your home, each fully vaccinated child will receive a gift card. Some children between the ages of 12 and 17 already received the $250 gift card in our first vaccine incentive giveaway held last year, and so unfortunately those individuals understandably will not be eligible for this second go-around. In some non-COVID related news this afternoon, Governor Bryan will be joining nonprofit Island Green Living for the groundbreaking of their ocean-bound plastics recycling program, which officially launches on St. John this Friday, February 18th. This program is the first plastic recycling program on St. John. Let me repeat that. This program is the first plastic recycling program on St. John. The plastic will be processed and recycled into valuable products and will complement the existing aluminum can recycling program and other sustainable initiatives that already exist. You can catch that ceremony right here on our Facebook page and later on the Government Access channel, which is channel 27 if you have VIA. So I would like to take this opportunity to congratulate everyone over there at Island Green Living for all of the great work that they're doing for these very, very needed environmental initiatives. Before I close, I know that Dr. Ellis may have had some other information that she needed to share before we closed out this afternoon, and so I'll take this opportunity to go back to Dr. Ellis. Dr. Ellis?
Okay, thank you for that. We want to remind you that it's important for all people 5 and older to get immunized against COVID. This includes vulnerable groups such as pregnant women and unborn babies. Territorial WIC Director Lorna Concepcion would like to share with you the reports of harmful effects of COVID infection during pregnancy. A recent study published reports that damage to the placenta of COVID-positive mothers can result in fetal death. Vaccination is recommended for all women of childbearing age during pregnancy and lactating mothers. Yes, it is safe and is the strongest weapon to ensure the safety of unborn babies. I would also like to mention another COVID-19 related item. Late last year, Chickasaw Nation Industries, one of our CDC subcontractors working on COVID-19 projects, developed an art contest for high school students. The object was to hear how high school students were reacting to the pandemic through their artwork. The contest began earlier this year, and artwork has been turned in. Now we are asking Virgin Islanders to visit the website and vote for your favorite piece of art. The website is www.comingthroughcovidusvi.art. I'll say that again, www.comingthroughcovidusvi.art. You can vote one time per island per email address, and voting starts Sunday, February 22nd at midnight. Winners will be chosen from a combination of votes from the digital gallery and a panel of judges. Winning entries will be announced after Monday, February 28th. 3 winners will be chosen from all 3 islands. First prize is $500, second prize $300, and third prize a $150 gift card. To keep up with the latest information, including COVID-19 epidemiology and vaccine data, please visit the U.S. Virgin Islands Department of Health Facebook page, www.covid19usvi.com, and for COVID-19 health information alerts, text COVID-19 USVI to 888-777. I'd also like to share some non-COVID information about another program the Department of Health has going on right now. The Chronic Disease Control Program is hosting a series of free 6-week virtual Zoom chronic disease series control sessions designed to help people living with chronic conditions such as diabetes, arthritis, high blood pressure, heart disease, pain, anxiety, or other chronic illnesses take control of their lives. The classes start on Tuesday, February 22nd, and continue every Tuesday until March 29th, 2022. Attendees can choose morning or evening classes, 10 a.m. to 12:30 p.m. or 5:30 p.m. to 8 p.m. To sign up, email Dr. Linnea Fredericks at linnea.fredericks, that's LYNA.FREDERICKS, @doh.vi.gov. To sign up, you can also call 340-774-7477, extension 5675, or 340-718-1311, extension 3798, and leave a voicemail. Thank you for the time to share this valuable information. I'm happy to take any questions. Back to you, Director Moda.
Thank you, Dr. Ellis. So in closing this afternoon, I want to invite you all to join us here on Facebook Live and on the Government Access Channel at 6 p.m. Atlantic Standard Time for the next episode of Inside the Cabinet with Property and Procurement Commissioner Anthony Thomas, where he will discuss the new and exciting advances taking place over at the department to include the new GVI buy program, which will make easier and less cumbersome the contracting process between the government of the Virgin Islands and vendors wanting to do business with the government. If you are a current vendor, a potential vendor, or just someone wanting a better understanding of the process, I encourage you all to tune in tomorrow right here, as I mentioned, on our Facebook page or on the Government Access Channel, which is channel 27 if you have VIA. At this point, I will take any questions from the media if there are any. And I see that we have a couple of media joining us virtually, so I will first go to Suzanne Ellis from the Virgin Islands Source. Go ahead, Suzanne.
Thank you, Richard, and good afternoon. I have a couple of questions for Dr. Ellis.
Go ahead.
The first one is, what is the latest news on the Legionnaire's disease in the territory?
Thank you for that question. We are investigating a couple of cases of Legionnaire's disease in the territory. As we announced at the press conference last week, we have collected samples related to those cases, and those samples are currently in the process of being tested.
So there haven't been any new cases, it's just still the 2 people?
There have been no additional cases since our last report.
Okay. We didn't learn much last week about how these people might have contracted the disease, such as if they were in a group setting, or if they got them off island. Can you give us a better clue about that?
So I know last week we did discuss how you can get be exposed to Legionella. Legionella is a bacteria that is commonly found in cistern water. It's a freshwater bacteria, and the way you get it is actually when that bacteria becomes aerosolized and you breathe it in, and it can cause lung damage. The way it gets aerosolized is usually through hot tubs or sometimes shower faucets. So we collected water from sources where the individuals that did get it may have come into contact with those water sources, and that'll help us determine if certain water sources were a risk factor for those individuals or not.
So you're still determining that?
Correct.
Okay, and the second question is, of the positive cases that we have this week, what percentage would you say are vaccinated?
Out of the positive cases, we do have what are called breakthrough cases, and that's when someone that's fully vaccinated does become positive. Out of the ones that are currently active, approximately 10% right now are fully vaccinated.
Okay, thank you.
My pleasure.
Thank you for that, Suzanne. We have another reporter joining us virtually from the Virgin Islands Daily News. Go ahead.
Good afternoon. afternoon. This is Sarah Kirkpatrick. I don't have any questions at this time. Thank you.
Good afternoon, Sarah. Thank you for joining us. So that concludes our briefing this afternoon. Thank you. And remember to wear your mask, practice social distancing, and get both the vaccine and booster now that they are available. Thank you, and we'll see you all next Monday.